Hello and welcome to Unstress. My name is Dr. Ron Ehrlich. Before we start, I'd like to acknowledge to the traditional owners of the land on which I am recording this podcast, the Gadigal people of the Eora Nation, and recognise their continuing connection to land, waters and culture. I pay my respects to their elders of the past, present and emerging. Hello and welcome to Unstress. My name is Dr. Ron Ehrlich. Well, the new year, 2021, promises hopefully to be a much better one than last year. But we need to equip ourselves with all sorts of elements to build resilience. That's ultimately the key. The best way of dealing with stress is to build resilience into your life. So my guest today is a contributor to that picture. His name is Dr. Kjell Hovic. And he has co-authored a book called When Crisis Strikes, 5 Steps to Heal Your Brain, Body and Life from Chronic Stress. You can understand the appeal when I had the opportunity to speak to him about this. Kjell is an award-winning psychologist specialising in clinical neuropsychology. Now that's a term that is new to me, but we explore that. And he took his doctorate, his PhD, on emotional, thought and behavioural problems in youth with developmental disorders. He's also worked with elite sports people, and we touch on both these issues and many others in this episode. I hope you enjoy this conversation I had with Dr. Kjell Hovic. Welcome to the show, Kjell.
Well, thank you for having me. I'm excited about this. You're a long way away.
We are. You are currently speaking to me from, where are you? Tell us where you are, because it's quite a famous site.
Well, some of your listeners and viewers might recognize or remember the Winter Olympics in 1994. That was in Lillehammer in Norway. It's in the southern part of Norway, but it's in inland Norway, and it's the ideal climate for nice dry snow conditions in the wintertime. So we're just at the start of the season now, so we've been out skiing just this last weekend, so it's pretty exciting time. But as I was saying, it's quite, the days are quite short here, just 6 hours now in the winter time. So we have to kind of make use of that time, and then we spend time behind the fireplace in the evenings. That's kind of cozy as well.
Now, you've written this fabulous book, When Crisis Strikes, which is just about to come out. It's coming out in the end of December 2020. It's December 2020, 5 Steps to Heal Your Brain. And we're going to talk about some of the aspects of that. But I wondered if you might share with our listener a little bit about your own professional journey that's brought you to this point and brought you to writing this book.
Well, interesting. My personal background is I was active in sports. Actually, I was an active golfer for many years, way back when, and I had an injury, and so I was not able to kind of just take that full sports experience fully out. And I also kind of understood I was a better teacher than a player. So I started actually starting some junior programs and really teaching young people to play golf. And as I knew as a golfer or as an athlete myself, I knew that the difference between the best and the next best was always the mental. The X factor was the mental aspect. So what could we do to improve that? And I started working with young children or the young sports golfers in the program, with all kinds of mental training, like visualization training, pre-shot training, all these mental things that are just so key for golfers. It turns out that I was doing this in Lillehammer, where there was also lots of ski jumpers that were actually training with us in the same hall, the Olympic hall, and they were like, "Hey, what are you guys doing? Hey, we want to do that." So it kind of expanded into different areas, some alpine skiers and also the ski jumpers, which are in many ways the same type of psychological process, where nothing really gets going until you start it, right? So you have to have a very good preparation before you then perform or hit the ball or make the ski jump. It's really very, very critical that the mental aspects are in place, right? So yeah, I had experience with that. And then just this is maybe turning out a little bit long, but
That's
I
okay.
found out that, hey, I didn't really know about this, about it as much. And I said, well, how do I figure out, how do I learn about this? Well, I go to school and learn about it, right? So I went back and then I studied, the clinical psychology and actually became a clinical neuropsychologist, and continued using and then understood a little more. And I said, hey, I'm on the right track. This is the important thing for sports athletes. And I kind of then expanded into different areas. As I was saying, my day job is really working at the hospital with young adults and young teenagers that are suffering from early signs of psychosis, which is a serious thought disorder, right? They're seeing things, or hearing things, thinking things that are just very bizarre, very unusual. And then our jobs are, in a team with a big team of professionals, is trying to find out how we can help them get back to school if they've dropped out of school, get back into work, get back into functioning properly, in their everyday lives, not isolating and hiding in a basement and doing escape strategies, often with either on the computer or with drugs or other kinds of dangerous things. So we try to help them get integrated back into their lives and help them as much as we can. So that's part of that day job, which I use a lot in the back. And yeah, now we get to the book, right? If I can say something about that, because I'm a co-author in this book, and I've written it together with an American psychiatrist. So a little different perspective, right? Well, you're a doctor, right? And she is also a doctor, and I'm really from the psychology, or the psychology side of it. So coming as a doctor, having a PhD, coming from that side, but we kind of understood that when thinking about these modern problems that everybody in the modern world is experiencing. I know you write a lot about this, Dr. Ehrlich, right? About problems with, let's say, chronic illnesses, family crises, sudden loss, traumas, these things that are often, part of the everyday experience as we get older, tremendous stress factors. How do we then deal with it? What's a way of getting away from that? Or how do we heal from these problems? And we understood that, well, working with very extreme cases of people under stress, we kind of learn, we know some tricks and some techniques and some, we have something in our toolbox that we can use. So we thought, well, can we put this into a product that will help as a self-help guide, for people that maybe are not that far into a mental health crisis, but more in a life crisis, right? We wrote the book in 2019, delivered it or submitted it then, and then wham, this whole thing with COVID came up right in 2020 in March. We were doing the edits, so we were able to kind of add some chapters about how we dealt or were dealing with the COVID crisis in our own lives using the steps as well. So it's a personal book describing some of our experience with it, and then we have probably like 24 different vignettes or cases of people suffering in different life crises and how they use the 5 steps to get more balance in their lives. So that's a little of the background.
Yeah. And you mentioned the word clinical neuropsychologist, because I've heard the term clinical psychologist, but you've added this extra important word. Tell us how the distinction is. What's the distinction there? What does that add to us?
Well, a clinical neuropsychologist is maybe a little more aware of the brain behavior interface, right? So what's going on in our brains and how is that affecting our behavior? I guess you could say the psychologists are in the same way, but maybe a neuropsychologist is a little more biology based, a little more brain based. The way that we go about our assessments is not just asking thousands of questions, which a psychologist would do, but we also do a lot of cognitive testing. So I want to know how the person learns, how they learn, if they learn in with verbal stimuli, is that better? Or they're maybe more visual? Do they learn that way? How is their memory? Is the memory good? Is it not so good? How do they hold their focus and concentration? Do they have, good focus and concentration over a short period of time, over a longer period of time? How is their decision-making skills? Are they good at planning? Are they very impulsive? Are they flexible mentally? They can switch from one task to another task, or do they prefer to then work on one task over a long period of time? So a lot of these that one might associate with, some people might say personality characteristics, but I would maybe call them also some of these traits cognitive characteristics, right? Way of people, since I took my PhD with children that have developmental disorders, so children with ADHD, right? Problems with concentrating and focus, very agitated, children with autism, or autism spectrum disorders like Asperger's, right? They have their social difficulties and social problems, and also with Tourette's, so that people maybe are known with people who have tics, right, which is an impulse disorder. So I have that perspective, wanting to know really everything about the person, not just their background, their history, all the difficulties and the problems, but also who they are as a person, their personality, the way they react, the way they think, the way they learn. Maybe in a way thinking that's a good way to try to understand how we can change their behavior if they need to change their behavior, or they need to work to heal, right? If they're in a crisis situation.
Wow, I feel like I should book in a session with you. I'd love to explore a lot of those aspects. But youth mental health, well, mental health in general, is a huge and growing problem. We certainly hear about that in Australia, and I know it's a big problem in the States too. Is this what you're also seeing in your practices in Norway and in Europe in general?
It is. I mean, it's a a growing problem. It's a challenge. I mean, I think we have to be open about that there's a wide variety, a wide variation of difficulties, right? A lot of the very serious patients that I usually work with at my hospital, they are actually people that they like to be isolated. They don't want to have contact because they have social anxiety difficulties, right? So we spend maybe a year trying to teach them to get out into the open, get out into the public, take the bus, do things like that, and then suddenly everything's locked down. And in many ways, maybe they're happy about that because then they don't have to push themselves, right? But in general, a lot of our patients become much more uneasy because of this uncertain, right, future. They don't know what's going to happen. They don't know when things are going to happen, and they don't know their place in that future, right? It's becoming more difficult for everybody. And families are affected, and people that normally were functioning quite well are also struggling. So we do find it's an increasing problem, and it's concerning for sure.
Yes, the trends in Australia are definitely, and it's concerning. And there's always this balance between nature and nurture, isn't it? The genetic, the environmental aspect, and I mean, with a growing problem, it's hard to justify it as just a purely genetic issue, isn't it? What are some of those factors that are, that you see that are causing this increase in stress in these kind of disorders, mental health disorders?
Well, I think what we see a lot is of the people that are really struggling is this increase in anxiety issues and also depression, right? Which often has to do with just essentially being, more in isolation. Very, we can see it maybe particularly in people that maybe have personality characteristics where they were very extrovert, they were very social, they're very dependent on social interaction for kind of reinforcement and for these issues of self-esteem. And then when they don't have that contact, they don't get that feedback by being together with other people and having fun times with other people, then they're a little more vulnerable. So we do see that there's this difference in certain types of maybe personality characteristics are more vulnerable in the situation and less resilient. I know this is a topic that you talk a lot about, resiliency, right? Than other people that are more maybe independent, maybe more individualistic, and they have maybe and they maybe have better strategies for coping with being alone in a difficult period of time, right? So there's that, and then there's this, how do they react to also being alone and maybe struggling with things, if there's work situations that are problematic, if there's family situations. Of course, being alone or being together with your family in an unusual way all the time also poses quite a bit of stress in family situations, right?
Mm.
And then these stresses, then if they're not dealt with in a positive, in a good way, then they can then compound other difficulties. And then you have this, we talk about this in the book, about, unhealthy or not good coping strategies, right? Choosing to, maybe work more, or to be on, the computer more, or if you're watching porn all the time, or if you're starting to drink more often, or if you're, these kinds of things are really can be very complicating coping mechanisms, or short-term coping mechanisms that really can become, compound difficult situations. So there's something about finding back to that balance, that good balance in your life. And maybe if you haven't had that balance before, then trying to find it, right? To try to
Mm.
rediscover a good balance that gives you and makes you a little more resilient to whatever stressors and difficulties that might come about and
Mm.
arise.
It's an incredible period we're going through at the moment. I mean, that's an understatement if ever there was one. But this almost global period of reflection for us all as individuals and as a society. I mean, how do you, this pandemic, you've raised some issues there, but when we have changes to our brain, when chronic stress can damage our brain, how does that work? What kind of effect can this chronic stress have on our brain health?
Well, this is part of what we start off with, and my co-author, Dr. Jennifer Love, she's a medical doctor, and describes this really well, which is, you think of, if you think of the stress response, you know, uh, I can describe it easily. One of the examples I give in the book is that you can imagine, for example, if you've had a, a I don't know, if you have an older brother, for example, and you're young and you're going out to take the trash out at night, and he's hidden behind some place and jumps out and really scares the bejesus out of you, right? In when you're out there, that that reaction is a stress response, right? Which is setting your body in motion to either fight or flee, as the traditional way of describing it. And you have you have two systems in your body, one that's activating, right, your focus and energy and everything to deal with this crisis, and then you have another system that's a little slower, which is relaxing it. But this activating system, parasympathetic system, is just pumping adrenaline out into your system, and your all the energy is really going to your inner organs, the survival organs, and it's going out of these brain areas, so you're not able to make the same good decisions as you usually would. And of course, in the example with that young boy, he usually, once he discovers it's his brother, then that the stress is over. But if you're thinking of very, very many of these modern kind of crises that we can discover, that we experience, like a family conflict or a breakup, or a really conflictful breakup, or a trauma with a serious emotional abuse or things of that nature, or even a cancer diagnosis and things like that, or even a cancer diagnosis of a loved one, or dementia of a parent. These kinds of things, these are really what you also talk about, like modern type of crises that aren't just sudden and over, like the tiger that was going to eat you, like for millennia ago. It's something that's there all the time, and if your system is just activated all the time, worrying and stressed about this, then you're going to be worn down. You're going to kind of break down, and your whole body, your energy and your focus and your cognitive faculties, everything is going to be worn down in that process. So the question is, how can we deal with these things? Because we know that we're all going to experience them in some way or another. If you're, some people experience them quite early, but if you're living into your 40s and 50s and 60s, which is more commonly in the modern societies, right? everybody will experience these types of modern crises that are very, very stressful. And how can we survive them without letting them just kind of overtake us and overwhelm us, and then just, again, going into escape strategies and doing, negative things that are just going to break us down. So trying to help us find that balance. And that was a little of the background of Dr. Love and my idea behind the book, is that can we find steps and techniques that you can use for many types of crises, right? Not just this one or this other one, but in general, different types of crises, of these modern crises that typically last over a long period of time, many, many years or tens of years even. If you have a chronic illness or a chronic pain situation, that's going to last maybe a long time. So how can you stop the process of getting addicted to opioids? That's a quite common problem in the US, and I mean, it happens everywhere. It happens here in Norway as well. So how can we deal with these types of crises in a healthy way that's going to get ourselves back on balance? So that's kind of the little bit of the background.
Yeah, it's so interesting, because I have been in my own clinical practice for almost 40 years, actually more, but that's another story. And I've become very interested in musculoskeletal pain, chronic musculoskeletal pain, and realized that muscles have memory. And an accident or a trauma that occurred when you were 5, 6, 7, 10, 20, that memory in the muscle can continue through a lifetime. And it's so interesting to hear you speak about this from a mental perspective, because when we're dealing with chronic stress, people often get tremendous breakthroughs by reflecting on past traumas as well, because not only do muscles have memory, but so does our brain. I mean, to state the obvious. And that impact is huge. Tell me, you've written this book, When Crisis Strikes, and my goodness, I guess we can definitely say for all of us, crisis has struck. There are 5 steps to heal your brain, and obviously our listener is going to be reading this book. Let's take that as a given. But I wondered if you can just give us a little bit of a hint as to what these 5 steps are.
Right. Well, I can say part of the interesting from what we were talking about before about stress, one of the starting points is this understanding what stress is, and for a person to kind of map out the stressors in their lives. And of course, for every individual, it's going to be unique, right? So the way that we've made these steps there's not one size fits all. It's a general way of addressing the individual person's situation. Context matters. So if you have, 5 people who have all had a terrible breakup, they're all going to have different stressors in their lives. Maybe some have a chronic illness. Maybe some have lost their job, or some have problems with a child who's a developmental disorder that's raging every day. I mean, there's all kinds of. So part of that starting point is really to get an idea of what are the important stressors in your life, understanding how you also react to those stressors, right? Because we're all different in the way that we react to them. Some are very sensitive and will overreact or react very quickly and very sensitive, and others are more resilient and maybe not as quick to react. So that's part of the understanding. And then there's kind of a step-by-step approach where we're then taking a grip of the situation, getting an overview, understanding our own situation and our own stressors and what we want to prioritize. So it's very kind of individual oriented, very goal oriented, very kind of concrete, specific. Let's work on this. How can we then reduce this difficulty or this problem? If it's maybe grief after a loss, or if it's a family crisis because of some raging children that are out of control, or maybe they're doing drugs and that's causing all kinds of chaos. These kinds of things, putting really a concrete description on that problem, and then starting the process of trying to figure out, well, what can we do about it? What do we have control over? What don't we have control over? What steps can we take that to change the things that we don't have control over? There's a step that has to do with taking care of oneself in the whole process, right? we often forget about that because you're in a crisis, you're in crisis mode, you're just reacting to chaos around you, right? We often use the example of some kind of like a bomb landing in some sandy desert and just blowing up all kinds of dust, and you can't really see correctly or properly. So part of that, the process is just getting a good perspective on your situation, getting a handle on it, getting a grip on it, and then taking the steps to heal, and then at the same time also take care of yourself in that same process, and also then get a better understanding of who you are. Back to this thing of understanding your personality traits, which traits do you want to kind of cultivate and maybe nurture, and are there traits that maybe aren't helpful in that process and you want to maybe kind of tone down a bit. But again, it's part of that process of really looking and reflecting over all these aspects that are causing difficulties, and then making a strategy and working out a program to work yourself out of it. So we're not allowed to go detailed into the steps, just to tell you that, but just talking a little general. And I'm using lots of sports psychology things. There's a lot of cognitive traits, techniques that we're using, a lot of even positive psychology, a lot of holistic things. We kind of feel it's like a way of organizing a toolbox, a therapist toolbox, right? But for the person themselves, if they're able to then work through it themselves, if they have the awareness and the self-insight of their difficulties, we have a part that also is, it's very important that if a person is not able to see and reflect over their own situation, it's important for them to get external help, right? To get maybe a therapist or somebody that can work with them through that process, to help them be a sounding board and help them put their finger on the important steps that need to be taken. But the book is written kind of as a self-help guide for everyone, really, just to kind of use it. And like I was saying, both Jennifer and I, we're using it in our own lives. I just kind of discovered that, hey, let's use this systematically when the whole COVID experience, because we both ended up, being isolated. She's in Southern California and I'm here in Norway. And how could we use the steps to help us kind of gain control of this crisis situation that we're in, and maybe even turn it into something that can be positive for ourselves and our own development. So we took that challenge, and I think that's been really a learning experience too.
I mean, it's music to our ears because this program is very much about personal empowerment. And I've often said that while we can't control events or necessarily people in our lives, we can definitely control the way we think about it. And that is an easy thing to say in many ways, but then it comes back to this question of resilience. In order to be able to control the way you think about something, you need to have the resilience to do it. And that opens up a whole can of worms too, doesn't it? I mean, for example, I've got a gut feeling about something, well, the connection between gut and brain has been very well established. Do you see this as an important part of your dealings when you're looking at youth mental health, for example? I mean, we're talking about mental health as a spectrum, and when we're starting to go down the path of ADHD and autism, we are down quite a way in that spectrum. What role do you think these kind of things, like, for example, diet, might have on mental health? What are you seeing?
Well, I mean, I think that very many young people, in my experience, I mean, they're more concerned about what their peers are doing, right, than what their parents are telling them to do. That's a pretty typical issue, and they don't want to, stick out. They don't want to be any different. So they're usually, doing the same things as their peer group. And but when they kind of encounter these very, very serious difficulties, they maybe often have a chance to maybe think about how they're living their life, and what you're bringing up, which is so important. What are they eating, and is it on a regular basis? And of course, some people are more sensitive to that than others. Some people cannot their mood is totally dependent on how much they're eating and when they're eating and what they're eating, and becoming aware of that and knowing how that affects your mood and how it affects your way of interacting with people, and also how it affects your cognitive facilities, or your cognitive functioning, about memory, about concentration, about which again in turn then affects how you're doing with planning and organizing. I mean, all these things are kind of connected. So we try to, and as a neuropsychologist, I always end the line on the reports that that good routines, eating, sleeping, all these kinds of really common sense practices is what is going to be important to kind of have a focus on. So how can we get back to that, help that? And that's what we do with these people that come in that are admitted to the hospital completely, in a terrible state. Part of that process is really just trying to balance their rhythm and their practices and their habits. And hopefully that is the start of a healing process. And then, of course, if there's more serious things that we need to bring in, maybe the medical doctors, maybe if it's an extreme case, with medication, if that's necessary. I mean, as a psychologist, I'm kind of against it, right? We don't want to do it. We don't want it unless it has to. But I mean, we have young people who come in that are so in such a bad state, with terrible thought difficulties and hallucinations, and so many difficulties that just to kind of get them calmed down, it's necessary to use a certain help from the doctors and their medications, just to get that that start for that balance, and then hopefully we can get them off very quickly, and then into a better working rhythm going forward.
I mean, taking a step back from what you're dealing with in your book here, but looking at the general field of mental health, one of the criticisms, and it's interesting that your co-author is a psychiatrist, one of the criticisms of psychiatry nowadays is that it's pathologized everybody. Like when the DSM, the Diagnostic Schedule, Statistics Manual, when the DSM came out 20 or 30 years ago, DSM-1, it was 100 pages long and it had 50 conditions. And now DSM-5 is 900 pages long, and I think there are hundreds of or conditions. And you mentioned social anxiety. I mean, I know this may surprise people, I used to think of myself as shy, but now I actually have a name I can put to that: social anxiety disorder. You live in Norway, and presumably you mentioned you're only getting sun at 3 o'clock, up to 3 o'clock. And a lot of people go, gee, I feel so much better in the summer than I do in the winter. Well, guess what? That's seasonal affective disorder. And there are medications to support each of those. What's your view of how these trends have occurred?
It's an interesting kind of topic, because we're often struggling, in the hospital system, even in Norway, which is I feel very well organized in many ways and interested in. It's not for profit. It's really just focused on the best interest of the individual, and yet you have these systems put in place that for anybody to get any help or treatment, they need to have a diagnosis, right? They need to have a label. And I hate that, right? Because I'm thinking that people are so much more complex than a label. And of course, as having taken a PhD and having done some research, I understand how important it is to be able to have, let's say, grouping, so that how are you going to help, let's say, a group that maybe is struggling with concentration problems, then to do research on it, you need to be able to define, well, what is that, and who is that group? So that's a positive thing, right? To be able to have groups so that you can understand how to help those groups better. And I think in many ways, modern medicine, or at least modern psychology and modern techniques have improved the treatment of many people that are struggling with very serious disorders. But back to your situation, your suggestion is like, but does everybody have to have a label, right? Does everybody have to have a diagnosis? And I think that's really a danger, because I mean, we have to accept that we're all different, and there's these variations, and there's differences on a scale, and we need to try to learn how to be able to really just get that in balance and not always pathologize it, as you're as you're saying that there's a tendency. And I do kind of experience this, and now my co-author isn't here to kind of defend the system in the U.S. to put it that way, but my mother lives there, so I know her situation, and it's just amazing how many pills she's taking for everything, and I'm just desperately trying to say, well, it's like 15, 20 different pills for each little thing. You get a pill, right? But who's doing research on what all these pills are doing and all these mixtures are doing, right? And have you had somebody who can tell you exactly what to do instead of taking that pill, like changing your diet, right? Or changing your habits, or changing your sleep hygiene, practices, or changing. These are the kinds of things that I'm really concerned or really thinking about with these young kids, and not trying to get to these quick fixes that something's going to fix it by that pill or that drink or that whatever. It's a bigger issue that we need to kind of teach people about, and I think you're doing that in your way in your books too.
Yeah, well, it's so interesting you should draw on your experience of your mother in the States, because I think the statistic is something like 5% of the world's population, America, are taking 50% of the world's psychotropic drugs. And I think on the top OECD countries, America comes in pretty low down on the list. And I guess the question is the primary goal of a healthcare system the health of the population, or is it to sell medications? And we could argue about that. But in Norway, just tell us a little bit, because I'm often surprised when I speak to people in America that they somehow feel a universal healthcare system that looks after every citizen is somehow a communist plot. How are things in Norway? How is your healthcare system set up? Is it universal healthcare system?
We have a universal healthcare system as the basis. There's also a parallel private system. Yeah. So for people that are let's say, and maybe some businesses where they have personnel who need to have really urgent treatment or urgent care quickly to get them back into work, then they will maybe take advantage of the private system. But we all kind of very, very proud and very kind of kind of surround that we want to have this universal system, so that everybody who needs help gets help, right, based on their need and not how much they can pay. That's an important prerequisite. Yeah. And of course that also has it also, at least, I actually lived many years in the US, so I know a bit about that system, and coming to Norway as well, then I kind of see the difference. And you can see that there's not the same conflict level, because if there are things that happen that are accidents, or things that then you're getting all the care that you need, right? So that the health system is helping you and healing you without you having to sue everybody who didn't do this thing or didn't do that thing or didn't put the label on the microwave oven for this thing or whatever. I mean, it's a little more peaceful in that way, right? Because we all want to take care of each other. We're all concerned about each other. So there's that attitude to begin with. We're doing everything we can, not only for each other, but also for the environment, and trying to, pay attention to those aspects. But then we want to then not just really raise up the conflict level if there are problems or difficulties. We want to try to resolve it in the best way possible, and one way of doing that is with the healthcare system, I think, that we have. So we're very much kind of concerned about that and loyal to keeping that going. I mean, of course, there's this issue of there's certain specific expertise. Well, we're a small country, so we can't have the top experts in every area. And you do have that in other places, in other countries where they have larger university systems. So there's not everything that can be resolved in our system in a small country, but we do feel that that's the way we'd like to have it, and we kind of feel that we want to preserve that and keep that as good as it can be. And I have to tell you too, just to give you another example of the way I see the type of children, young people that I'm working with, how much more, I would say, better care I feel that many of them get, having a system where they don't pay anything, their families don't pay anything. If they have a problem, they call us, we go out and we help them early before things are really, before things have really exploded into some really serious thing. We try to help them, get them back into shape, try to get them on the right track. And I experience the same type of young people that I've, in my experience in Southern California, that have similar types of things. They end up in the emergency room, they get some pills in their hands, they're sent out, and there's no follow-up, right? Unless they have a family that can follow them or help them, they're just, it's just so many tragic cases in that way. I mean, there's a lot of great treatment there too. So I don't want to,
Yes,
I don't
no,
want to
of
say that.
course.
I mean, probably the
No, no.
best treatment in the world can be found there. But the
Yeah.
question is it for everybody? Is it for us? We're a whole community, and we're in this together, right? We're in this boat together, and
Yes.
let's take care of each other. Otherwise, we're all going to tip over and fall out.
Well, Kjell, I got to tell you, I mean, that doesn't surprise me coming from the mouth of a Norwegian, because Norway is often listed as one of the top, if not the top country, in life, in the quality of life, and you are rightly proud of that. Australia has a universal system which looks after every individual, and we could pick holes in every one of our health systems, but that's a minimum. And you've added such a neurophysiological basis to this word conflict, which I think we've covered as well. Listen, we've covered a lot of great territory here. I want to take a step back now even further, because we're all on a health journey together through life. And I wondered, putting aside your role as a researcher and neurophysiologist, just as an individual on that health journey, what do you think the biggest challenge is for an individual on that journey in our modern world?
Well, I mean, one of the things I've kind of personally been, gotten very interested in, actually, really since the COVID situation started, is this idea of understanding that in the modern world, there's so many distractions, there's so much going on. There's the news, there's the things happening in town. There's all kinds of there's just always things that are stealing our attention here and there. And I've kind of tried to think about this idea of, well, it's really this idea of mindfulness, right? Being present in the moment. How much are we always like looking to the future? That's going to help us. That's going to solve the problem. That's going to be the kind of the panacea that's going to help us or save us in some way. Whereas what can we do right now in the present, just to enjoy the fact that we're alive, and that we're have all our senses, that we can just appreciate let's say nature, for example, or appreciate our family members, or appreciate a good dinner, or appreciate whatever we're experiencing. How can we multiply that experience? We see that in memory. We have a lot of young people who've spent many years, they can't remember anything from their childhood. And why is that? Were they actually present in the moment during certain periods, so that that memory could be reinforced, or could be actually strengthened? Because as you bring in more senses to every experience, you have a stronger memory trace. So bringing in looking at something, experience something, bringing in the smell, bringing in what the sounds are, what is the feel of it, what is the sensation around it. That's one thing I've just been working on, trying to bring that more to the fore in my own life, because I've also been a person who's been working and just being really too busy, and reflecting also through the steps is like, hey, that I need to take this into my own life and do a change there as well. And can I really put more value in each moment and get more out of each moment? And so one of the things I'm doing is I'm a little more into taking photographs in nature. I mean, here in Norway, I'm living in such a beautiful area. There's quite a lot of nature, and like I was saying, there's a very short day in the
Mm,
wintertime. So it's valuable, right? So you kind of appreciate it a little more. I mean, I spent many years in Southern California. It's sunny all the time. It's beautiful all the time. But here, it's like, well, what are those important moments that I can, or those images that I can get of the sun rising or the sun setting, or the clouds and the formations that are forming over the lake, for example, or what's happening. And of course, there's seasons here, so we experience
mm.
the 4 seasons pretty extreme, and I'm trying to really just understand that and get that and experience that in an intense way. So.
Well,
mm,
Kjell, thank you for being so present here with us in this last period of time, and thank you for sharing with us today.
mm. Well, thank you so much for having me, and I'm just really interested in learning a little more about what you've been writing about, because you're really contributing quite a bit to this whole idea of improving and healing and seeing the balance and the whole aspect of one's life.
Thank you.
Thank you.
So interesting to hear from a neuropsychologist, a clinical neuropsychologist, in a part of the world that we hear so much about, Norway. It's always up there as number one or two, or certainly in the top two or three of places to live in terms of life experience, good quality of life, that is. And Kjell touched on the idea of the one thing we have is the ability to control the way we think about things. And that, as I said, is easy to say, but in order to be able to do that, you need to build resilience. And we're talking about building resilience in this program all the time. And I think worth remembering here that, life I see as a balancing act. He talks about identifying and minimizing stresses, and he's talking about some of those psychological impacts, some of those life experiences that have passed and that are still a very important part of your life, whether you remember them or reflect on them or not. The fact is that there is memory, just as there's muscle memory in chronic pain, there is trauma memory in psychological pain, and that is important. And he also touched on the fact that getting therapy sometimes is an important thing, and I've had the opportunity to do that on 3 or 4 occasions in my life, and I found them to be incredibly positive. I know a lot of my friends, some of my friends have said, oh, I don't need that, I've got friends. But the thing about talking to a qualified practitioner, psychologist, or a psychiatrist, I guess. I mean, I always associate psychiatry with medication and psychologists with talking therapy, but whatever, the ability to talk to a professional is in and of itself a very cathartic experience. To organize your thoughts and express them to a total stranger who is just focused on you is a very cathartic experience, irrespective of whatever else follows. And what should follow is their professional expertise in prompting you in certain questions which bring a revelation to yourself through their help. I've found it to be incredibly powerful. And also in my life, I've actually used some psychotherapy sessions to overcome really bad hay fever and allergies, which were a total surprise to me. And I think I've mentioned that in the past. But the point being about controlling one's thoughts is controlling how we deal with stress is a really important tool we have, but you need to build resilience, and often you need professional help, and occasionally, and I believe in a short term, medication has its place as well. So I thought that was a great opportunity to connect there and to hear the insights about the difference between an American healthcare system, which is built on financial ends, and a universal healthcare system, which is in the US, in Norway, and in Australia too, which we can be proud of, is something I am incredibly proud of as well. But to see how conflict sets up a neurophysiological effect, which in itself is very stressful, is an experience in itself. So I hope you've enjoyed that. This year is going to be a very exciting year. We've got so many great things planned. Don't forget to leave us a review on iTunes. Want to push the ratings up. We've got some great online courses. Keep in touch with that. Visit the website or download the app Unstressed with Dr. Ron Ehrlich and stay in touch with all the latest episodes and all the latest events, many coming up this year. So I hope this finds you well. Until then, until next time, be well. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.